My name's Melissa Bowley. As I mentioned, CEO and founder of Flourish Care. We are a maternal health care company, ultimately really coming from the community standpoint and working in partnership with clinical care teams. And what I mean by that is what everyone's kind of talked about is there's a whole spectrum of care, and most of it happens within the hospital, or at least that's the way people think about it. But there's also all of the support. Like think about while you're pregnant, giving birth and then postpartum, 80% of the time you're actually outside of the hospital walls. So, how are you getting that support, joining support groups, getting childbirth education, getting parenthood education? Doula care is one big aspect of that. So, ultimately, what we see that as, we call it wraparound care, which means it's that care that exists outside of just your clinical care team. We work in partnership with the clinical care team ultimately to ensure that you get all the resources that you need and that you have the best possible experience. So again, not replacing your OB, your midwife, your social worker, your mental health therapist, the team that you've built. We're working in conjunction with them. It just we come from the community standpoint. So we are similar. We're usually moms ourselves, similar lived experiences, ultimately providing that support wherever you need it in home, in the clinic, and also via telehealth. It really depends on what your needs are. Ultimately, what we're doing at Flourish Care is matching you to a doula that's culturally matched, speaks your language. We have interpreter services. So ultimately, giving you that support from very early on in your pregnancy. As soon as you find out you're pregnant, you can reach out and see if doula care is covered for you, and then you can get that support. We love to engage as early as possible because then we can help prepare and get you to the resources that you need. But again, if you're already had a baby, you're still eligible for doula services. That's one of the big questions we get all the time is if I've already had my baby, is there any doula support that I'm eligible for? And the answer is yes. And I'll talk about what that looks like. But really supporting you from early pregnancy all the way to through 12 months postpartum. And then depending on your insurance, typically what's covered is 6 to 8 visits of in-person birth support at the hospital. So that means you get 6 to 8 visits around the birth, and then you also get somebody who shows up to the hospital and supports you during that birth. And we have some amazing people. You'll have Bridget talk about from the doula perspective what that support looks like, and then we'll also have some parents talking about what does that actually mean. Um, Doulas support a whole range of different needs. So again, it's very personalized. So if you need help building a birth plan, that's usually one of the first steps that we do, and it's actually part of an educational packet that we send out to every patient. In-hospital birth support is part of many packages as well. And breastfeeding, bottle feeding, social needs. This has been a huge one that a lot of our doulas are getting very involved in. Sometimes they'll work really closely with the social work team or community health worker. Other times they're linking directly to community resources. Sometimes churches, really depends on what the needs are. Supporting you through perinatal mood disorders. So we've had a number of patients who didn't know what was going on, why they were kind of transitioning from what we would think are baby blues into something more serious. And the doulas are able to kind of identify that and work with you to make sure that you have the right resources. Postpartum recovery care, your body goes through a lot during birth, and there's certain things that you may not know about. There's, ongoing bleeding through 6 weeks. Oftentimes people don't talk about these things, and that's really where a doula can come in and help support you, help you understand what's normal, how to get the support that you need when things are not normal. Offer in-home newborn care. So do you need help with, how to get the baby to get some sleep? Do you need help with lactation? Do you need help with like how to swaddle? All of those things are things that doulas do during that entire time. So again, there's lots of options and it's very personalized to what your specific needs are. And at the end of the day, the goal of the doula is to empower you. So you feel like I know exactly what I need to do. I know how I'm going to be able to provide for my family. I know how to care for my newborn. I know how to care for myself and put my needs first, because if mom's not okay, the rest of the family's not okay. So that's something that's very, very crucial. And doulas focus a lot on the mother's needs, sometimes even more than the baby's needs. Again, depending on what the patient ultimately needs. So insurance coverage, this is a big kind of web of information, and it's constantly changing. So we wanted to be very clear about where things stand today. Anna Sophia talked about it. Rhode Island was the first state in the country to actually require by law that doula care be covered for almost every single pregnant person or postpartum person in the state of Rhode Island. So that means private covered, so commercial plans and Medicaid plans, which is really, really huge. There's a couple other states that have now joined on to that as well, but in Rhode Island, that is the requirement. There are some loopholes, so I want to talk a little bit about that. And then Mass Health, I know we have a couple of patients joining from Massachusetts as well. They just went live with coverage in the January timeframe was when we started supporting births, and they implemented 6 to 8 visits and in-person birth as well. So I'll talk about the differences. The most extensive coverage today is through Blue Cross Blue Shield of Rhode Island. They recently changed it in March of this year. You get up to 15 hours of telehealth or in-person support, again, based on what your needs are, and those can be strung together. So let's say you're really struggling postpartum. It's a couple days after the baby's there, baby's been born. Somebody can come into your home and support you for multiple hours. So you can, essentially get 5 3-hour visits. You can get 3 5-hour visits. You can have 15 1-hour visits. It's really up to you. And those can be used from the time you're pregnant all the way through to 6 to 12 months postpartum, again, depending on the plan. So you definitely want to check your coverage ahead of time. And then in-person birth support is included there. Neighborhood Health Plan, United Healthcare, Tufts and Harvard Pilgrim in Rhode Island. They all have 6 1-hour visits, the minimum of 1-hour visits, in person or via telehealth, again, during that pregnancy or postpartum, in addition to in-person birth support. TRICARE, it's actually 6 30-minute visits, and it has to be after 20 weeks pregnant. We actually had a patient that recently came to us that was 20 weeks pregnant, and currently her claims are being denied because they need her to be 21 weeks pregnant. So there's a lot of red tape around these things. You really want to check your coverage before you start engaging with a doula, and then doulas need to be credentialed through each one of these insurance plans in order to offer that coverage. Cigna, it's actually unlimited visits. It needs to be based on medical necessity. So there has to be a reason that you need doula care, but the reason is that you're pregnant. And then Mass Health, 6 to 8 visits. So you get a total of 8 hours of support, and you can use that as 90-minute visits or 60-minute visits via telehealth or in person. And you also get that in-person birth support, which means they come to the hospital and they support you through comfort measures, ensuring that they're advocating for your needs, that the birth plan is known by all of the team, the clinical care team. And then some of the coverage that's not required right now by the state of Rhode Island, fully insured commercial plans. So this is when you have Blue Cross Blue Shield of Massachusetts. They are currently not offering this, although we're getting a lot of requests from patients who have Blue Cross Blue Shield of Massachusetts. Self-insured plans, so these are large employers. Sometimes they're not covering it. There are things we can do to change that. There's a lot of ways that we can advocate to the company. The HR teams really just need to check a box saying we'd like to offer doula care. So there's things that we can do. If you're interested in advocating through your employer and you're not covered, reach out to us because we can help you there. And then government plans and Medicare plans. I hope that helps kind of explain the differences. I know it's still very confusing, but you can always reach out to us. There's a QR code here. We will check your specific coverage. You just send us a picture of your insurance card, or you can actually just send us your member ID. We can check with your insurance plan and your specific coverage to let you know what is actually covered, and then we can link you up with a doula to see if it's a good fit for you. These are just some examples of specific things, because I think one of the questions we get a lot from patients is, what does a doula do? What can they do for me? And I think we talked about kind of a general list, but really building the birth plan, reducing the amount of interventions. That's what I used a doula for. The doula that was there during my birth really helped with pain management. I ended up not having an epidural, had the natural delivery that I wanted, and I 100% believe that's because the doula was there helping me to understand the different interventions that were being offered and which ones made sense for me, which ones did not. Supporting you and the baby after delivery, helping you adjust to new parenthood, because as Anna Sophia mentioned, These are things that we don't necessarily always prepare for. So having somebody in your corner that you can just text or they can come over and help you is really, really key. Helping you recover, breastfeeding and formula support, household tasks. So sometimes, as Anna Sophia had talked about, in other countries, you are supposed to just be resting and supporting that newborn for 40 days, which means other things still need to get done. So if somebody comes over, you can also tell them, like, I really just need some help with some of these other things so I can focus on the newborn. Learn about the birthing process. Different birthing positions is a big one that a lot of patients are asking their doulas for. And then the great thing is you don't have to remember all this stuff. I took all the childbirth education classes, but in the moment, my husband and I, while we were in the hospital, actually, I was giving birth. I don't remember all those things. I felt knowledgeable, but at the end of the day, I could tap into this resource. I called her an encyclopedia, Lauren, my doula, and ask the questions about what position should I be doing now. So I didn't have to worry about those things, and ultimately getting questions answered and connecting you to all the local resources.